Hello, my name is Blessing Anabaraonye. I am a graduate student in the Psychiatric and Mental Health Nurse Practitioner program at Eastern Kentucky University. This is my poster presentation for NSC 892. The problem identified for this project is medication compliance in patients with schizophrenia. Compliance to antipsychotic medications is very important in the management of schizophrenia, control of symptoms, and prevention of complications. Research shows that medication compliance is a major problem among patients with schizophrenia because 40 to 70% of schizophrenics are non-compliant with their medications. Non-compliance is associated with increased readmission rates, suicides, financial costs, relapses, aggressive incidents, and disabilities. Mental care providers can play an important role in improving medication compliance by providing education on medications, illnesses, drug interactions, side effects, and benefits of medication compliance. The purpose of this project is to implement motivational interviewing in an outpatient setting to examine the effects of MI when compared to routine psychiatric care on medication compliance in patients with schizophrenia. The target audience for this presentation is advanced practice nurses. Literature search was conducted and current methods of improving medication compliance includes motivational interviewing, cognitive behavioral therapy, psychoeducation, and sending phone reminders. Numerous research studies provided evidence that MI is effective in improving medication compliance in patients with schizophrenia. 4 randomized control studies were critically appraised and reviewed and provided evidence that MI is effective in improving medication compliance in patients with schizophrenia. The proposed intervention is adherence-based motivational interviewing. The focus population for the implementation of intervention is adults 18 years and older diagnosed with schizophrenia and receiving outpatient treatment. Patients that meet the inclusion criteria will be asked to participate in the study for 4 months, followed by 6 months follow-up period. 60 subjects will be recruited, with 30 randomized into the MI group and 30 into the routine care group. A total of 8 2-hour sections of MI will be provided to each subject in the MI group. The 5 principles of MI to be used are roll with resistance, express empathy, avoid argumentation, develop discrepancy, and support self-efficacy. Routine psychiatric care will be provided to the subjects in the control group. An adherence ratings care will be completed before intervention and monthly for 6 months following intervention. Outcome measures. Improvement in medication compliance can be measured by counting pills, or the subjects will be asked to keep diaries of their medication use or to complete mail surveys about their medication use. Reliability. Both the pill count and self-reports are not accurate methods of assessing outcomes. Pill counts are subjective methods of measuring an outcome and is not a reliable method because removing the correct number of pills from the container does not necessarily mean the patient follows the dosing consistently. Some patients may overestimate their medication intake, and also researchers may not be able to properly carry out the assessment if the patients do not return the diary or if the patient reports false increases in their adherence rate. If the expected outcome of improved medication compliance is achieved from this project, it will provide nurses and other mental health care providers with information to better understand the MI model and encourage them to apply the principles of MI as a new strategy to improve medication compliance in patients with schizophrenia. I would like to express my gratitude to my facilitator, Dr. Mary Walker, as well as Dr. Donna Colley for their guidance. and my fellow students for their input throughout this project. This is the end of my presentation. Thank you.